posterolateral fissure dividing the posterior lobe and flocculonodular lobe. This is the posterolateral fissure. Okay. So, how you divide the cerebellum functionally? Okay. So, the vermis, you have to know the vermis, and this is the paravermis. Okay. Vermis and paravermis is control the midline posture. We call it paleocerebellum for the posture. And then beside the paravermis is the hemisphere. We call it neocerebella to control the all your movement, fine movement, the eye, the gaze. This is by the neocerebellum. And last but not least, the flocculonodular lobe itself. So it's archicerebellum, control the gait. Okay. So functionally, the cerebellum are divided into the paleocerebellum, which consists of vermis and paravermis. Neocerebellum consists of the hemisphere, lateral to the paravermis, and archicerebellum consists of flocculonodular lobe. It has different function. Okay, that's why we call it. That's why we divide the lobe also in functional. Okay, if in anatomically it only has the anterior lobe, posterior lobe, as well as the flocculonodular lobe. Okay, so can you appreciate? Okay, so this is all. Yeah, you have to know the surfaces, the fissure. Okay, and the lobes, either anatomically or functionally. Okay, so the vallecula, you have to appreciate the vallecula also, the deep impression of the vermis at the inferior surface. This is the vallecula. So when we cut into two, we cut half, sagittal cut. Okay, so this is the example of the sagittal cut. Can you see the cerebellum? This is the cerebellum. Okay. Alright, this is nice view. This is sagittal cut. Okay. So you can see, wait, let me check. Okay, this is the superior, like this. Okay, this is superior surface. And this is the inferior surface. Okay, this look like the okay, this is look like a right lobe, right hemisphere, right cerebellar hemisphere. Okay, you can see this is the midbrain, pons, and medulla. Okay. So you imagine this is your right cerebellar hemisphere in sagittal cut. You see from the median view. This is the view. Okay. So this view, this sagittal cut, it cut exactly, exactly on the vermis. Okay, because midline. This is the vermis area. Okay. So you know the vermis area. Okay, what we can see. This is the area of the floor of the fourth ventricle. Okay, and this is the area of this is the vermis. You can see this is the attachment of the superior cerebellar peduncle. Again, let me show you. Okay, from this view. Superior cerebellar peduncle. Here. Attachment here, superior cerebellar peduncle. Attaching the cerebellum into the midbrain. Okay. This is the middle cerebellar peduncle. Is better view on the lateral view. This is the middle cerebellar peduncle. Attach the cerebellum to the pons. And this is the inferior cerebellar peduncle. Inferior and superior cerebellar peduncle is very tiny. This is the inferior cerebellar peduncle attaching the cerebellum to the pons. This is superior cerebellar peduncle. Here, very small here. This one attaching the cerebellum to the midbrain. Okay. So this is the superior vallicular, inferior vallicular. Okay, and this is the part of the vermis. Okay, so lingula, this is lingula, central lobule, and culmen. Lingula, central lobule. Okay, sorry, let me check again. This is lingula, central lobule, and culmen. Okay, so sorry, let's see the fissure. Lingula, central lobule, and culmen. Culmen is here. So these are all the vermis that belong to the anterior lobe. Okay, so the vermis of the anterior lobe ada tiga: lingula, central lobule, and culmen. Okay, see the fissure here, and then followed by decleve and decleve and folia. Decleve and folia. Okay, so it's belong to the posterior lobe, but at the superior surface. Okay, and then followed by the tuber, pyramid, and uvula. Okay, tak nampak tuber, pyramid, uvula, and last but not least is the nodule. Okay, you cannot see the nodule here. Alright, so it's okay. So this is the vermis. This is the vermis. The lingula, central lobule, culmen. Okay, decleve, folia, and then this is the area of tuber, pyramid, and uvula, and last but not least is nodule. Okay, this is look like a nodule that belong to the floccular nodular lobe. Okay, that is vermis, and you can see the grey matter and white matter. Okay, the grey matter is inner, or the other name is arbovitae. Arbovitae is the other name of the grey matter, of the white matter of the cerebellum. Okay, and outer cortex is the grey matter. In cerebellum, we call it folia. Okay, in cerebrum, we call it gyri. Okay, but it's still both of them are grey matter. Okay, that is cerebellum. Okay, see, this is the very obvious middle cerebellar peduncle. Okay, so the middle cerebellar peduncle only afferent. Okay, there's no efferent structure going out via middle cerebellar peduncle. Okay, the efferent only superior cerebellar peduncle and inferior cerebellar peduncle. Okay, however, the afferent can go all three of them, superior, middle, or inferior cerebellar peduncle. I forgot to show you the okay, this is, can you see the layer here? Okay, very small layer, they attached to the gyrus. This is the pia matter, pia matter. Okay, so I don't think you have the dura matter. So because I want to show you the tentorium cerebelli. The tentorium cerebelli is between the cerebellum and cerebrum. Okay, so atas ni cerebrum. Okay, it's supposed to have the here tentorium cerebelli. It's just the projection of the dura mater, folding of the dura mater between the cerebrum and cerebellum. Okay, so that is the important structure of the cerebellum. The blood supply, Okay, this is cerebellum. There's blood supply posteriorly by the pica. It's pica, posterior inferior cerebellar artery, supply the posterior part of the cerebellum. The pica is one of the branch from the vertebral artery. Okay, inferior part of the cerebellum by the anterior inferior cerebellar artery. Anterior inferior cerebellar artery is a branch from the basilar artery. Okay, and one more at superior part, superior cerebellar artery is also branch from the basilar artery. So got three